Doctor Says 360.
Hi, my name is Dr. James Cobb. I'm an ENT specialist. In my experience, I usually diagnose a patient with vertigo. Basically, I want to know what is the cause of their vertigo. And usually, I can diagnose them pretty much with a very good history. Okay? So when a patient comes into my clinic, I usually ask them an open-ended question. What can I do for you? Can you describe what you feel? Can you tell me more about your dizziness? So that starts the question. And then based on that, I will tailor my question to how long does it last for? Is it something that comes and goes? Is there any particular trigger? What time of the day does it come? And then I go to my examination. Then usually a good bedside examination is good enough. I do a few tests. I look at their eyes. I look for abnormal movement of their eyes, which is called nystagmus. Then if I suspect they have BPPV, I do a few examinations based on BPPV. So a lot of my examination would be based on what I suspect the patient will have. So for example, if I feel they have a weakness on one side of the ear. So for example, vestibular neuritis. Most of them don't come to see me when they are very dizzy. They come to see me after 2 weeks. They will give me the history. I had severe vertigo. I was admitted to the hospital for a few days. They diagnosed me with vertigo, but I still feel dizzy. So then I said, sounds like vestibular neuritis. Let's do a test. Let's see whether you have a weakness. So I perform something like a head impulse test. I look at any delay in the movement in their eyes. I do a Romberg test. I let them stand on a foam mat and see which side they sway to. That sometimes tells me where is their weakness. So basically the bedside examination is very helpful to pretty much confirm what I suspect they have. Sometimes I also do hearing tests for them if I suspect they have something what we call labyrinthitis. So labyrinthitis is like vestibular neuritis but with hearing loss as well. Another test for, just now we mentioned Meniere's disease or even migraine. Sometimes patients have fluctuating hearing loss. So they will have hearing loss one day. After a few days, their hearing gets better. Then after a few weeks, they have a hearing loss again. So that tells me this one could be Meniere's disease. I don't have video nystagmography. I think that is a useful tool if you have it, but it's very expensive. I don't have it, but based on my experience with whatever I have now, I can pretty much diagnose most of my patients. So the duration of vertigo is actually a very key point for doctors because based on the duration, sometimes we can narrow down the diagnosis. For example, BPPV is vertigo dizziness that usually only lasts for a few seconds, not more than a minute. Migraines can last, they change. They can sometimes last for a few minutes, they can last a few hours, even sometimes a few days. Meniere's disease generally don't last more than 24 hours. Usually they last few hours, but generally not more than 24 hours. Vestibular neuritis, just now we mentioned, can last for days. There's another type of vertigo that I commonly seen in my clinic is something what we call PPPD, or persistent perceptual positional dizziness. That's a very mouthful, but in other words, sometimes we call this as functional dizziness. So basically this is more to do with the mental state of the patient. So a lot of patients, if they had history of vertigo, although it's treated, but they have this lingering dizziness all the time. And it's because we think that their brain is now on very high alert. So when we move, we usually don't think about it. But these kind of patients, they become very sensitive to movement. So every movement they make, they feel they are dizzy. And these patients are usually very miserable because they seem to have dizziness for a long time. Nobody knows what is wrong with them. They go and see many different doctors and nobody can tell them what they have. And it becomes like a vicious cycle. So they are constantly dizzy. they don't know what's wrong with them. They start having a lot of stress, anxiety, and they can go into depression, and this makes their dizziness worse. So I see a lot of patients like this. So sometimes I work very closely with my colleagues in psychiatry, mental health to help these patients.
Doctor Says 360.
If you like our channel, please like, share, and subscribe.